We hadn't had a snowstorm in, a couple years. And it seemed like everybody in the Delaware Valley was out sledding Saturday afternoon. I got a call from my resident that's in the hospital saying that they had gotten a heads up from trauma that a boy was being flown in with an epidural hematoma.
It was a Saturday. I was called by the trauma team and also by Dr. Yoakum's team. So I initiated my team, anesthesia team, and also the OR team to get ready for this surgery.
So I got in the car and started driving in and got more information as I was coming in. I talked to the trauma attending that was on call. The description of it was pretty clear that it was going to be somebody that was going to go right to surgery when they got here.
Right away, I knew that this was going to be an operative intervention and an emergent one from a neurosurgery standpoint. And at that point, we kind of started the ball rolling of getting everybody ready to accept this patient when he came here. It was a coordinated effort with the other hospital as well. They were not a pediatric trauma center, we were. And as we were getting more reports of how the patient was doing, I would call back and say, these are my recommendations, and they would implement them.
What happened when they landed, they went straight from the helipad resuscitation area to the OR. And with the injuries that they had, time is of the essence. The brain is under pressure and being compressed. And the longer it stays compressed, the more likelihood that permanent damage is going to occur. So that's why the speed with which they got to the operating room was so important.
When I got here, having given the OR the heads up, I walked into this room and there was probably 25 people in here, just ready to go. Everybody was setting up. There were people that were here just to run and get something if we needed it.
The most important thing is communication. We're in constant communication with the neurosurgeon, in this case, Dr. Yoakum, as well as the rest of the staff and the anesthesia team. That's key here. And so we know when the patient comes in, we know when they get to the helipad or when they get to the end of the hallway. And by the time they're coming in the doors, we are ready to go.
My resident, Clint, went up to the helipad with the trauma team. While he was up there, the trauma surgeon had gotten another call.
And I, of course, accepted it. I got off the phone and I turned to the neurosurgery chief and I said, "You're not going to believe this. We have a second one coming in."
When I heard the second alert, I sent half of this team to set up the another room. And I also called my backup anesthesiologist.
Boy number one rolls in here. Everybody sort of takes their part and we get him very quickly, prepped for surgery, anesthesia, asleep, to position on the table that's right behind me. And then as we're doing that surgery, I'm getting more information about patient number two coming in. And it became obvious from the description of the CT scan that he was going to also need surgery. As we finished this one, I quickly went out, talked to his mother, escorted her up to the pediatric ICU where she was waiting for her son to come back. And then I came back down and did surgery number two. I've been here long enough and been doing this for almost 25 years, the trauma that is, to know that what we did that Saturday afternoon was pretty special.
I've worked at many trauma centers around the country, but the cooperation here is the best I've ever seen. We're always ready. Because time is of the essence. When you're bleeding to death or have pressure on your brain, minutes count. And so we can't try to get things ready. They have to be ready at the beginning.
Sometimes we get an hour notice and sometimes we get 10 minutes notice. But when the patient comes in the room, we're ready to roll.
The reason why the other hospitals send the patients here is because we are the designated state level 1 trauma center for Southern New Jersey. So they know that when they get a difficult patient, they send them to us.
We are both an adult and a pediatric trauma center, so we can accommodate trauma patients of any age.
The special care that these two patients received is for everybody.